Hi, everybody. Welcome to today's episode. I'm pleased to be joined by Tanuj Sharma, CEO and founder of Kana Health. How are you today, Tanuj?
Doing wonderful. Thank you, Dario. Thanks for giving me the opportunity and pleasure talking to our audience today.
Excellent, excellent. So let's just start by diving in. Maybe just start, Tanuj, by explaining Kana Health and your core programs and product.
Absolutely, Dario. Kana Health is primarily an AI copilot for mental health therapists and clinicians. And our AI copilot simplifies and solves a lot of different problems these therapists and clinicians face across the life cycle of their patients. Right from onboarding their patient to understanding their patient to understanding what are the treatment options and the goals and the objectives of the therapy and how do they go about creating the most personalized and most effective treatment plan for them, because one size fit all mental health treatment doesn't really work. And with our platform, we are trying to personalize the mental health care based on every single patient they encounter, based on the deep understanding of those patients, and really coming up with those most personalized treatment intervention and techniques which these therapists can deploy.
Excellent, excellent. And what was your inspiration behind founding the company?
The inspiration was more, I would say, personally driven. We saw a lot of people, in our vicinity, in our close circles, struggling with mental health, including some of our own family members, both me and my co-founders. And especially after 2019 COVID, era, most of these situations really accentuated. And that is when we decided that, it'll be a shame if we don't put our, 20 plus technology career behind this in solving this problem and leveraging AI and machine learning and all of these techniques to surround these therapists and healthcare service providers and clinicians with, so that they can do their job more effectively, more efficiently, and with a very high personalized and effective care.
Can you just maybe help paint a picture of how a therapist would use your co-pilot with the patient?
Yeah, absolutely. Great question, actually, Dario. So the typical patient journey, starts with a therapist inviting their patient to start their onboarding on our mobile app, right? So there are two parts to the Copilot. One is the mobile app, which stays with the patient, and one is a therapist application, which is a web browser-based application, which stays with the therapist. So therapist invites the patient, they start their onboarding. The patient logs into the mobile app, create their personal profile, answer a few questions in terms of what brings them to the therapy, what are their goals, and what are their objectives which they're looking to solve for. And the conversations in the engagement with the mobile app starts from there. We encourage them to write their journals, log their mood, answer a few questions, go through their screeners and assessments as they may have been assigned by the therapist. And using all of those data points, we start to develop deeper understanding of what this patient is really looking for, what are they struggling with, what are their goals and objectives. And with that deeper understanding, we infuse those insights into the therapist treatment planning, the techniques to be used, which is the most effective therapeutic framework for this person, and what are their goals and objectives, what are the timelines, what are they looking for, and what is the best mechanism for really tracking them. So using those insights which we generate from the patient, we actually provide real-time guidance to the therapist when they are actually meeting with the patient, asking them questions that,
Mm.
are these the symptoms? Are these the objectives? Are these the goals? And as those conversations are happening, we infuse those insights in coming up with the best recommendation for what is the best treatment technique, what is the best treatment intervention, which they can use and create that timeline and the plan that for these goals and objectives, this is the most effective treatment plan. And then the AI copilot just doesn't stop there. It actually tracks the patient in between therapist sessions. That is, this patient really showing signs of improvement and outcome or
Mm.
not? And if they're not showing signs of improvement, then what are those tweaks in the treatment plan which we can make so that this patient is on the way for improvement and showing positive signs of turnaround? And which basically becomes a mechanism for these therapists to stay in touch with their patients in between the sessions as well.
Interesting. So the co-pilot helps with the diagnosis, and then it actually tracks the progress of the patient based on the information that they're putting into the application, correct?
That is correct, and it is much bigger than diagnosis. It starts with understanding the patient, your goals and objectives. Then, what are your symptoms? What are your physical impairments? What are those things which you're not able to do, which you were able to do earlier? And we use all of those insights to present those information options in front of therapists so that they can create the best treatment plan for them. And that is what we intend to do. We don't intend to diagnose the medical condition itself.
Gotcha.
We intend to understand the patient best so that we can infuse and integrate those clinical insights into the treatment plan.
Pilot.
Hence, copilot, yes.
Gotcha.
And that is why, our copilot stays with the patient and the therapist
Yep.
across the entire life cycle, right from onboarding to the first-time treatment planning to tracking whether the treatment plan is actually working or not. And then finally to the discharge, that now this patient is ready for discharge. And, these are the improvements and outcomes we have driven along their, 5 months or 6 months or
Yep.
8 months long journey of therapy. And then, provide those measurable and objective outcomes, which they can actually share with those insurance companies as well, because most of these insurance companies are actually looking for measurable outcomes, which
Gotcha.
the therapists and clinicians are able to drive.
Interesting. So what unique challenges did you face building an AI solution specifically for mental health care?
Oh, there were a ton.
Yeah, I'm sure.
There were a ton. The first and foremost challenge was data, right? I mean, how much should be our reliance on real-world clinical evidence? Because there are two parts to it. If you use too much, then you're completely biased by the data because that data is grounded in the history,
Yep.
right? But the future is not the same as the history was. And for a simple example of that, the way social media has changed the landscape of mental health in just last 5 years is completely unprecedented. But if you use the last 10-year data of real-world clinical evidence, you would rarely find any historical evidence of how social media changed the mental health of a specific teenager or adolescent or a young adult, right? So the first challenge was data, that how much data we use and how much we should rely on, because the future is not the same as the past was.
Right.
The second part was how do we use that, a patient understanding to provide those information option in terms of what are those best treatment techniques and, treatment options for this specific patient. So we had to create the best golden source of truth because unfortunately in mental health, there is no one golden source of truth. There are many golden sources of truth. And most of these therapists and healthcare service providers and clinicians, they go to a specific school or they practice in a specific organization, and their benchmark of clinical guidelines and treatment guidelines to use is basically dependent on which school they went to and where they practice.
Right.
Because there is no one standard source. So we had to kind of create our own ground truth, right? Ground source of truth. In terms of, the National Institute of Health, National Institute of Mental Health, American Psychiatry Association, American Psychology Association, and various other, the large bodies, which have done a lot of research, evidence-based outcome. And we had to create, those clinical guidelines and standards of our own, using these standards, and then come up with those treatment information and recommendations for the therapist. So I would say those two were the biggest. And the third was basically painting the picture of how the future would change using AI in mental health care. And it was difficult because we had to envision how these therapists would use the AI copilot because there is no precedence of it. And, you can't really ask for feedback because unless you present how the future state would look like, nobody would know whether this would work for me or not. So we had to completely envision how AI copilot can change how these therapists provide mental health care today.
And what was their receptivity to it? Because obviously this is a very different way of working with the patient. So I'm just curious.
Yes, the reception was, I think, for most part, was great.
Yep.
They loved a lot of those things which were put on autopilot, like onboarding the patient, the initial assessments and the screeners and asking those questions, which they felt they were getting a lot more richer and deeper responses because now these patients were not filling out paper forms standing in front of a clinician's office or on somebody's front desk. They were answering these questions sitting in their living room on their couch from complete privacy and complete safe and secure zone.
Right.
So the quality of the responses and the answer and the depth of the answer were much more richer. They loved it. They loved a lot of these processes of onboarding, initial engagement put on autopilot. They loved the part of tracking the patient in between sessions.
Yep.
That, now I'm able to keep in touch, keep in pulse with what my patients are going through, on the week-to-week basis or day-to-day basis in terms of their school life, in terms of their work life, in terms of their social life. And what are those things they're talking about in terms of, asking their questions on the chat part of the things which they're writing in their journal. Of course, we keep the patient's privacy intact, but we just summarize those insights and share that, okay, so-and-so person felt a lot of stress this week at work because of, they missed a promotion or they got fired or some kid at school, got bullied. And, when they show up the next time, these are those conversations you probably need to have. So they'll love a lot of these parts. Yes, we had to fine tune some of those application features in terms of, how the treatment options should be presented, how the patient's understanding, patient summary should be presented, to what level of detail. What level of detail should be kept at the patient level, and what level of detail should be exposed at the therapist level. So those are some of those fine tunings which we had to do to really create the future state of
Right.
How mental health care would look like.
Fascinating. Is there a regulatory component to this, Tanuj? Is it regulated? Is it?
Absolutely. It is regulated. It is regulated by FDA, and FDA regulations are that don't play any role in emergency response or crisis situation. Don't diagnose any of these disorders. So we leave the diagnosis and the symptom evaluation and conclusion completely to the therapist.
Gotcha.
Don't be too prescriptive in terms of the treatment recommendation. The therapist should apply their own judgment that these are the best treatment options for the patient. So we present the information option in such a way that therapists are completely in control and they are applying their judgment in terms of what are the best treatment options. So those are some of the key FDA regulations which we are completely compliant of.
Excellent, excellent. So again, it's the whole notion of the copilot concept, as opposed to like the psychologist in the box kind of thing.
Yeah. So the intent is to not to do the job for the therapist. The intent is to help them do their job.
Right, right. Excellent. What about your go-to-market approach? Tell us a little bit about that. How do you create awareness, opportunities, convert sales in this marketplace?
Yeah. The go-to-market approach at this point of time, while we are a very small startup, is pretty much direct to therapists, right? So
Yep.
we are directly reaching out to a lot of therapists. We explain our value statement, and we are telling them that we are here to surround you with the AI and machine learning tools so that you can do what is in the best interest of your patient, so that you have a lot more time and you have a lot less burden. There are two types of burdens as well, administrative and cognitive burden. So if you have less administrative burden, less cognitive burden, you'll be able to focus more on your patients. And that is the messaging which we are delivering to our therapist, and they see a lot of value. And we are currently direct to consumer, direct to therapist kind of a reach out approach through social media, through emails. And after we have done a pilot with, I would say, 200, 300 therapists, then we would start reaching out to the therapy chains, therapy offices, smaller nonprofit organizations, who have 100, 200, 300, up to 500 therapists on their payroll. And we would kind of start scaling our effort from there on. And then eventually, we want to get to the healthcare systems, the health plan systems, the larger clinical chains, which are, across the country. And that is how we would kind of make our entry into the enterprise segment as well.
Excellent, excellent. Did you seek outside funding for your company?
Yes. So we have raised, I would say about $350K worth of pre-seed right now.
Yep.
And, we are looking to start our seed round pretty soon, as soon as we launch in the month of April. And, we'll be looking to raise our seed round worth $2.5 million.
Excellent.
to really, amp up our, clinical research, regulatory research, amp up our sales and marketing efforts, and create an enterprise version which is ready for, the hospitals and healthcare
Right.
systems and large clinical chains and large nonprofit organizations and so on and so forth.
So what did you learn? Did you have any when you raised your pre-seed, was there anything in particular that was challenging? I mean, you have a very new concept. Was it friends and family? How did you approach that part of it?
Yeah, I mean, it is challenging because what we are doing has never been done before, right? And if you look across the landscape, clinical decision support platform for behavioral health clinicians, behavioral health service providers, there are none.
Right.
There are literally just a couple of names across the globe, and there are none in the United States. So what we are doing has never been done before. So it was not easy for us to explain one very deep and technical platform. Two, it's a very deep domain-centric platform that, what is a clinical decision support platform for a therapist and how does it work? And, how do you help them make better clinical decisions? So it's not an easy problem to explain, leave alone the solution.
Right.
So it was difficult for us to find the right set of investors, but I would say the harder you work, the luckier you get, and we
Sure.
did find a good investor. We are very proud of the kind of expertise and advisory he brings to the table. He's an angel. He's an executive founder himself, and we are loving the partnership with him so far.
Excellent. Excellent. So just wrapping up here, Tanuj, this has been just a fascinating interview. So thank you very much. What are the top 2 or 3 lessons that you've learned building your company that you would share with other AI CEOs in healthcare?
Yes, I would say a lot of us, primarily, who come from technology background, right? We need to start from customer requirements and completely work backward from there, right? Do a lot of customer interviews right up front so that you know exactly the problems you're looking to solve for, right? Because we should never be lost in terms of the love of the technology. We should be lost in the love of how to solve the problem and how to create something meaningful and impactful for what your customers really need. And the second thing I would say is, try to go through day in life of your customer.
Yeah.
How do they start their day and how they finish their day, and probably over a period of a week. That would give you a lot of those mundane insights, which may seem like, a nothing problem, but it's a big enough problem to be solved. And if you solve them, that is how you really unlock the customer value and the potential. So I would say we should really start from there. And when you think of your AI or technology roadmap, you should design and define that roadmap based on that customer discovery. Spend a lot of time on that.
And I think what's interesting about your product is that you have both the whatever the clinician, the psychologist, and then you have or the therapist, and you have the patient. Did you do that for both? Tell us a little bit about how you again brought those two pieces together because that's somewhat unique.
Yeah. So we actually, a little bit of a, backstory. We actually started with creating an engagement platform for patient first.
Ah,
And then we started interviewing therapists that, hey, we are trying to build this platform for patients so that, this becomes a platform when a patient feels for the first ever time, they feel something is off about their mental health or behavioral health. Where do they go? Which is that app they would download and ask the question for the very first time that I'm not feeling something is off and how do I get help? So we wanted to design that platform and we started interviewing therapists and, we went on LinkedIn and we sent a lot of messages. Hey, we want to talk to you for 30 minutes because we are trying to design this platform right for the patients. And since you're a, therapist and a healthcare service provider, you know best what works for the patients or not. And as we did those conversations, almost 50 to 60 of those, it became very clear in our mind that we cannot solve this problem just by building it for patients. We have to build it for therapists first
yep.
and bridge the gap between the patient and the therapist. And that is when we can really make the impact of AI and machine learning, solving it for both sides of the equation.
Yep.
And until unless you create that digital bridge between the patient and the therapist, you cannot make an impact. And that is when we did a micro pivot that instead of just building it for patients, we have to build it for therapists first. And
Excellent, excellent. Wow. Well, this has been fascinating, and I love your mission. And I wish you all the best of success going forward. This is very inspirational. So thank you very much.
Thank you, Dario, for your time today, and really appreciate time from our listeners as well.